I am Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. And today we will be talking about gene therapy for hair loss. First of all, welcome to the new world. So, a lot of people have asked me, what is this gene therapy for hair loss? And how is this therapy actually a gene therapy? And how we can use it in our hair loss situation? So let's start with some basic definitions first and understand how we can control or affect our genes or our genome. So start with the definition. Gene therapy would be any way in which we can modify the way our genes work, the way our genes make their specific proteins or RNA. So that can be through various means. One is to introduce a gene particle into the body or a RNA. The other is to introduce the gene protein, the protein which the genes make. And the third is to introduce a protein which influences the gene to make a particular protein or an enzyme or an RNA. So these are three broad ways in which we can do. We are now proceeding with the base level of gene therapy, that is products introduced into the human body that can modify the way the gene is making its protein or the gene expression, right? So that is where we have to understand. For example, TERT, that is telomerase reverse transcriptase. Now this is a protein or a molecule, you can say, which when it exists in our skin, it stimulates, signals our stem cells to start multiplying at a rapid pace. So that is an interesting thing, and a lot of research has been carried out on this. Now we'll talk about something even more basic than this. We have to understand the difference between gene, genome and epigenome. So gene or genome, we all know, that is what we inherit from our parents. But just like the color of our eyes, it remains the same. Let's say it is dark brown. It will remain dark brown since the day we are born to the day we die. But the gene for hair loss, that is also inherited. It's not a single gene either. But that gene is in a sleeping mode when we are born. That is the simplest way to understand it. That's why we are not born bald. It's not that my father was bald, so I was born bald. So it gets activated at a particular time and then hair loss starts. That particular activation happens through our epigenome. Epigenome, if you have to understand in an easy way, is the environment of our genes. Now this environment consists of all the hormones, the nutrition, the harmful chemicals due to pollution or anything which enters our body through our breath, through our mouth, through our skin, and our own hormones. Like if you are under stress, then cortisol levels will increase. They also have an effect. So all of them make the epigenome. Epigenome means above the genome. So if our genome is a software program, then epigenome is the person who is operating that program. So with the epigenome, we can make decisions on which genes have to act in which way. Now that is a very far-fetched thing at present, but the scientists and researchers are working on these, and we have been able to identify these things, the epigenetic events, and how to modify our genome in some instances, especially in terms of our hair. So that is where we come to the gene therapy for hair loss, part 1. Now we are in a position where we have some products, some molecules which have been used in research, and they have shown to have a positive influence on the stem cells of our hair. So what happens when you are losing hair? When we are losing hair, usually at start there is a epigenetic event. Some people, they have a bad diet, a illness, or a change of place. Anything can be that. The way of recognizing that epigenetic event would be that the person says after that he lost a lot of hair. So once you notice this epigenetic event, one should try to reverse it. So if it is a lot of stress, try to reverse that. If your diet has gone wrong, reverse it, correct it. Because our genes are exposed to all these things. Now, that is a broad view in which to do. What we have come across is 5 novel products, 5 molecules which have been shown to help the stem cells start multiplying again. And in thinning hair or miniaturizing hair, when the stem cells can be stimulated to start multiplying again, that results in stronger hair. And that is our aim, to reverse thinning hair so that the person can get thicker, healthy hair for the longest possible time. We do not make any promises of magic cure, as well as the fact that we do not make any promises that this hair will remain for a lifetime. This research is recent, so anyway I cannot tell you what will happen in 5 years from now. But I can say that these molecules are very safe, at least most of them are very safe, and you can use them, and people have been using them orally, taking those supplements for a long time. Now let's talk about those molecules. They are resveratrol, NMN. NMN, the full form is nicotinamide mononucleotide. Fisetin, grapeseed extract, and calcium alpha ketoglutarate or alpha ketoglutarate, AKG for short. Now these are the products which we will be working on. We have been researching on some of them. We have found very good response from some of them in our patients also, and me myself also. I am the patient number 0 for this. So now we go to the next part. Before we go to the next part, understand that when we say that there is gene therapy for hair loss, we are not going to modify your genes. We are not going to edit your genes. Ultimately, if you have the genes or the susceptibility for baldness, ultimately that will play out. Means ultimately at some age you will lose hair. But what is happening nowadays is that due to the unhealthy epigenome, I'll come to the fact what it means, an unhealthy epigenome. Due to an unhealthy epigenome, people are losing hair at a very early age in life. Similarly, telogen effluvium, or where you notice a lot of hair fall post any severe illness, that is not something which we can classify as androgenic alopecia. That also gets a lot of benefit from these treatments. So our aim is to treat premature hair loss, not androgenic alopecia in its entirety. It is possible that since resveratrol and grapeseed extract and NMN, they act on the stem cells to multiply them, encourage them to multiply. This is different from other medicines which used to be acting on different spots like minoxidil, whose actual action is not known, but it is said that the increase in blood supply causes it. That's why if you stop it, sometimes the blood supply reduces and the hair fall. Now in these substances, first of course I'll ask you that if something is doing good for you, then why would you stop doing it? Why would you stop applying resveratrol if it is helping you get good hair growth? But even then, what I have found in the studies is that it increases the number of stem cells, makes them multiply. So that is something which means that it may last with you for a very, very long time, one thing. Second, it can be used in females or ladies. Sometimes we cannot use minoxidil in ladies because they get hair growth all over their face also. So this thing can be used in ladies. Now, let's go to the basic level. What exactly do these supplements or these molecules do once they reach inside your skin? Yes. Our aim is not just to give them orally to you, our aim is that they reach inside your skin. That is where you will get the maximum benefit in terms of gene therapy for your hair. Now we'll talk about the three targets of these molecules of gene therapy. The first is the keratinocytes in our hair follicle. Now resveratrol acts on the hair follicles, fisetin also does. It acts on the keratinocytes of those are cells in our hair follicle, and makes them produce more TERT, telomerase reverse transcriptase. Now when more TERT is present around the hair follicles, it signals the stem cells of the hair follicles. Now there are stem cells present in the hair follicles, that's why they become long and strong. So this TERT directly affects the stem cells of the hair follicles so that they start multiplying. Once the stem cell starts multiplying, that is what makes the hair grow into the growth phase or anagen. So here we see a product which we are introducing into your skin, and it is acting on the genes inside the cells of your hair follicle, signaling them to produce products, proteins, enzymes, which then signal the stem cells to start multiplying. This is gene therapy at a base level. But this is just about what resveratrol and fisetin do at one location. The other effect of this is where they act on the senescent cells. Now what are senescent cells? That is also very important. I also call them senile cells or zombie cells. Now our hair follicles are a very fast growing organ of our body. Imagine, nothing grows as fast as your hair. So there must be something which is inside, which is multiplying. Those are the stem cells which are present in the dermal papilla and the bulge area. So now these stem cells, they get signals or they get a lack of nutrition, and then they don't multiply. That is when you see telogen effluvium or baldness, premature baldness. Now if we were to stimulate them correctly, they will multiply. But something else is also in the hair follicle. Those are melanocytes, the cells which give color to your hair. Now recent research shows that due to stress and other epigenetic events, these melanocytes, they turn zombie or senile or senescent as we call in scientific terms. So what is this senile cell? See, cells when they multiply or they carry out their life as it is, they have certain functions. An age comes when they can neither multiply nor carry out their functions, physiological functions correctly. That is when they can either die off or become out of control, that is cancer, or a third option remains where they become zombie or senile, means they don't do their work, they don't multiply, they just make harmful cytokines. So they make harmful cytokines which infect the cells around them and making them also senile. You must have seen this instance, like you notice a white hair growing in your beard and suddenly you start seeing more white hair around it. Those are your senile melanocytes at work. So fisetin, now this goes and it is a senolytic drug. It kills those senile cells. Any organ where cells are multiplying very rapidly, there is a high chance that you will have senile cells in that area, senescent cells in that area, and you need to remove them. Intermittent fasting and fasting for a long time is an easy way to remove them, and so is that we introduce these molecules into your skin in the target location. So that is where fisetin comes in. Now we have NMN, nicotinamide mononucleotide. It is a NAD precursor. If NAD, if you remember your school time biology, you will remember NAD is energy. As we age, energy keeps on going down. If it keeps on going down, it will go down in your hair follicles also. The stem cells will not have sufficient NAD to multiply. So, of course, we should give NAD precursors in form of NMN. NMN, however, is not stable for a long time. So, at present, I cannot give you a lotion or a cream which you can apply at home. So, right now, if you have to use NMN or Fisetin, we use them for our patients in our clinical setting under my observation. It can be once a month, it can be once in 6 months, but it has to be under my observation. Resveratrol and grapeseed, you can do it at home also. Growth factors, of course, again under my observation. Now these 5 things which we have, we will be using them in the gene therapy. So I will be talking about how you will be using them. So part 1. When you come to me, the first stage, 1, you should be physically fit. You should not be having any illness. You should not be diabetic. You should not be having some major infection, right? And assume that most people will go for a hair treatment only when they are otherwise healthy. So once you have done that, the first thing you do is, how much hair are you losing in a day? Just do this hair pull test. Just pull your hair and see how much hair you are getting in your hand. That is called a simple hair pull test. The other thing way is to take very clear pictures of the area where you have thinning hair. This is to be done before your treatment starts, before your gene therapy starts. So the next step will be a series of measures which I will tell you to take. Those are general body measures. It is like cold showers, intermittent fasting, intensive short-term exercise, correct sleeping patterns, breathing exercises, diet improvement. I'll ask you to have some things to eat which will supply you all the necessary nutrients also, and of course supplements, things which are needed for the hair to grow. Those are a separate thing. Now we come to next part. What will we be doing and what will you be doing at home? So next phase will be where we'll use a derma roller. You can also use a derma stem or a derma pen. Our main aim is to create fine holes or channels in your scalp, especially in the area where you have thin or thinning hair. And once the channels are created, your skin becomes more absorbent. Those channels are at least 1 millimeter deep because the derma roller has needles which are 1 millimeter in depth. So after those pinpricks with the needles, you apply the resveratrol and grapeseed extract serum lightly all over the scalp. At present, we compound it for our patients, we make it for our patients, so you can order it once we have seen your condition and you can start using it. So your first time when you come to us, we'll teach you how to use the derma roller in the correct way. Do not use it in the wrong way, it will damage your hair. Then apply resveratrol in grapeseed extract serum. Then, because we would have taken your blood to extract the growth factors, you can also call it PRP. So we'll apply those growth factors also on top of your scalp. Then we'll use the derma roller once again to push in those growth factors as well as resveratrol and grapeseed extract. See, this is as simple as the process in which you get tattoo. There also the ink is pushed into the skin. Here we are putting these molecules into your skin at a depth of at least 1 millimeter. That is where they will be in proximity to your stem cells, and that is how they will have action on the stem cells, and we have noticed increased hair growth. So the initial session I'll teach you how to use the derma roller correctly, how to apply the resveratrol and grapeseed extract serum. Then once you go back home, you repeat this process every week. One day in every week, Like I take the day off on Monday. So on Monday I apply the derma roller on my entire head. I also apply it on my forehead, on my face, on my neck. But if you are young, you can apply it only on your entire scalp. Then on Monday when you have applied that, after applying it, you apply resveratrol and grapeseed serum. I also apply NMN, but that is because I can do it for myself. When I have to do it for you, I'll ask you to come to me once a month. So once you go back home, you use the derma roller, apply the resveratrol grapeseed serum. That resveratrol grapeseed serum you have to apply once daily. You can do it at the bedtime. So I'll go over it once again. Apply derma roller once a week. Apply resveratrol serum every day. Come back to me after 1 month if you feel that we need to add the growth factors also to this mix. That time, if we think that we can make use of some NMN, we'll give you an NMN boost. This is a special proprietary way in which I use NMN so that it reaches your stem cells, the proximity of your stem cells, so that we give them that advantage also. So this is the first stage gene therapy. And how will you monitor the improvement? By very simple steps. Just like I told you initially, you do that hair pull test. Similarly, you do this hair pull test every week and see how much hair you get. See how much hair you notice on your pillow, in your hairbrush, in your towel. I am very happy to say that all the patients I have done till now, they have said that hair fall has stopped almost. But we'll be happy with hair fall being reduced. Even that much happens, and after about 3-4 sessions, I will be happy. By about 8 sessions or about 2 months, you should notice some improvement in the hair diameter as well as the length. So these are things which you will be able to see in your smartphones. You have cameras in the smartphones. Take close-up pictures. Take pictures of the same area. That will help you monitor. Remember, I do not have magic. I am not offering any magic cure. I am not saying that this is the ultimate treatment for hair loss. I am not saying that even bald people will regrow all their hair with this. This is for people who are having premature hair loss, hair thinning, hair loss due to chemotherapy or radiotherapy or any severe illness or after menopause or after childbirth. All those instances where the body is exposed to severe stress and people notice a lot of hair fall. There we'll use this gene therapy to strengthen your stem cells of the hair follicles so that they can again become healthy and multiply and give good strong hair. Watch this space. I will be talking about more improvements in gene therapy in the coming months to years. The next phase I plan is when gene proteins, which they are experimenting with at present, when they have been used for sufficient time with good track record, then we will see how they can help. But for present, if you want to enroll in our gene therapy program, do contact me at this email and the WhatsApp phone number which we have given at the end of the video. If you want to read up about the research on resveratrol, grapeseed extract, NMN and fisetin on our hair, we have the links in the description. Remember, this is very important knowledge or information. If you are losing hair or if someone you know or love is losing hair, he should have this knowledge. The faster you get this knowledge, the earlier this is used in your life, the more hair you will be able to save. I do not know, but I am very optimistic that the future is near when we will be able to reverse androgenic alopecia permanently in humans. I am not promising anything, but yes, the results are pointing in that direction. At present, we have reached the first stage, so you are welcome. Do share, like and subscribe to this channel. Do share the findings of this research with as many people as you can. And if your doctor does not know about this, do tell him about this. And if you have any questions or he has any questions, he is free to ask me about anything. Thank you. Bye bye.